My name is Dr. Lindsay Jaworski. I have been a chiropractor at Joint and Spine for 12 years. One of my favorite conditions to treat, headaches. I think the majority of my patients that come in with headaches, they don't really understand why they're getting them. Why the pain has been there for the whole day or maybe even coming back day after day. A lot of times the medical doctor will actually say, well, it must be a deficiency of ibuprofen. Just keep taking ibuprofen and your headache will go away. What we like to do is find out the root cause. Why is that headache coming back? So you can avoid those pills, because we all know that ibuprofen is not great for our kidney and liver. The majority of patients that come in with headaches, I would say up to 90%, actually have what's called cervicogenic headaches. So the actual pain is coming from the neck. So a lot of these patients have been in, let's say, a whiplash injury where this muscle has had damage. And you can see it causes the headache behind the head and up into the eye. So typically, when we look at the spine here, we notice these muscles can be the thing that gets so tight that it actually starts pinching the nerve. So people will say, I think I have a pinched nerve, and that's why I'm getting that headache. You're absolutely correct. But is it the muscle that's pinching the nerve, a disc that's pinching the nerve, or is it swelling from, let's say, a whiplash injury that sprained that muscle and caused the swelling to go up into the head? Those are the three things we find most common. I would say by far it's going to be these neck muscles in the front of the neck. So the first thing I do is, after I take that x-ray, I feel the muscles of the anterior neck. I feel in through here and up into the head. And if I feel that those are tight, we know that they're pinching on those nerves. Let's say I come in here and I don't feel swelling. Instead, I feel there's been an injury. There's a couple different things that we do to treat that. Number one, we use lasers. So instead of just adjusting the spine and doing the muscle work, we actually can heal it long term. The reason lasers are so valuable is because instead of just short-term pain relief, we can use lasers to soften the tissue long term. That way it doesn't come back. But adjust C1 and all of a sudden, blam, all those headaches are gone for good. That's a little bit about how we treat headaches a little differently than other places. We can find a long-term solution. That's why I love doing it here.